Hi everybody, it's Dr. Magnifico from Probably.com. This is Rue. He's about 1.5 year old, primarily Siamese cat. He showed up at the ER for megacolon, which is kind of, we use it sort of synonymously with constipation. And I'm going to teach his mom how to palpate. If God forbid this happens to your cat, there are a couple of things that we talk about, and we've already talked about some of this here. One of them is, I think it's pretty critical to increase activity. So to get these cats exercising, switch from a dry food to a primarily wet food, and I really like high quality wet food. Typically I say even add water to that. He is on multiple medications now. Typically we put them on lactulose, which is a stimulant, laxative, and we put him on cisapride, which is also a GI motility agent. So those two things are the staple drugs that we use for cats. And then we also talk about wet food, and I'm going to talk to her in a little while about also sub-Q fluids. But for these guys, we've got to get their GI tract moving. I'm going to show her how to palpate. So it's really critically important to, one, be monitoring the litter box, and two, to also understand what's going on inside your cat. And that's where palpation comes into play. So I'm just going to have you hold his head. So this is his spine. And then his pelvis is right here. So these are the bones of his pelvis, and then these are his knees. So this is the femur, this is the pelvis, and then this is the spine. And then right under here is where your colon lives. So literally it is the tubular structure that lives underneath the spine, right about here. The easiest way, in my opinion, is to have someone just kind of gently holding the head, and I come in with two hands underneath, so I'm sort of at his belly button, and I'm just palpating up. So I've got my fingers together, and I'm just coming up like this, and I'm looking for that tubular structure underneath the spine. In most cats, it should be about sort of the diameter of a quarter, maybe between a nickel and a quarter size. So it should just be a thin tube that you feel under the spine. And in most normal cats, you can actually feel the fecal balls in the colon, and you can separate them. For cats with megacolon, you will feel a tube that's typically about this big. So it does take a lot of practice, but it really is about the most important thing in understanding what's going on with your cat and your pet. In a veterinary hospital, that we use an x-ray, and that gives us an idea of how kind of constipated or backed up they are. We've got a friend. So the good news is that I really don't feel, I can feel his colon, and it feels larger than it should be, but it's soft, meaning I can put my fingers together and I can kind of indent the feces that are in the colon, instead of with constipated cat, and sometimes they're this big, and it feels like, it's a tube full of cement. It really feels very hard. Some of these guys are painful, some of them will meow. Typically they present as going to the litter box frequently, and they're posturing to defecate, but they can't get anything to move. So we're gonna practice a couple times with him, and then send his mom home with a homework assignment of palpating frequently and trying to understand what's going on inside. If you have any questions, you can find me at Probably.com. Take care, thanks.